Thank you, Doctor. Thank you, Dr. Neha. Thank you all. And it's time to start the international session. Today is the 1891st day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1891st day of uninterrupted daily webinar of IFPH. And today we are very privileged to have as our guest Dr. INDRANEEL BAWADEKAR, MD Homeopathy, LLB, DMJFM, PG Diploma in Forensic Medicine as our guest speaker. He is a homeopathic nephrologist practicing at Narayanpet and Kothurund, Pune. He do have more than 31 years of clinical experience, and he have done 40 CMEs to doctors and students, above 50 CMEs to doctors and students. And today our topic of discussion is homeopathic management of atherosclerosis with emphasis on miasmatic approach. Let us welcome Dr. INDRANEEL for the session. I welcome you all for the session. Doctor, let's start. You can unmute from your side, sir.
Yeah, sir, am I audible now?
Yes, yes.
Yeah, thank you for your kind introduction to the seminar. I welcome all the attendees, and also I am very much thankful for the IFPH team, Binduraj sir, Dr. Dhanesh sir, our senior Dr. Sahani sir, and all the attendees, and also for which I have forgotten the names. Today's topic will be very interesting as a part of being a homeopath. So firstly, I will say everybody that homeopathy has got a very good scope in atherosclerosis. We usually do not know, we only get cases which are already diagnosed by ICU physicians, then senior physicians, and they come to us for homeopathy. Friends, in ICU deaths, whichever are witnessed, many deaths are due to organ damages. For example, cardiac arrest, then myocardial infarctions, strokes, then even some pulmonary artery diseases, some renal shutdowns. All these diseases which are in chronic, they contribute to atherosclerosis, and the end result is losing human life. Homeopathy can cater much better in such cases. So today I'll be basically speaking on atherosclerosis and a miasmatic approach, because general atherosclerosis is a very wide term. We basically should know what should be the miasmatic approach. And then if we treat it, the results are amazing. We should be shortly going through the journey. I'll just share my screen and we'll begin with my presentation. Yeah. Yeah, sir, is it visible to everyone?
It's buffering.
Yeah.
Yeah, it's visible now.
Yeah. Yeah, so my topic for today will be homeopathic management of atherosclerosis with basic emphasis on the miasmatic approach. A homeopath has got a very good scope if he thinks for a miasm. So today we'll be talking about that. So may the power of this natural healing of homeopathy bring health, harmony, and wellness to all. This is the saying by Dr. Hahnemann. Now, friends, we all have learned this in our undergraduate days, but briefly I will be going not in detail about the introduction. Now, what is atherosclerosis? In everybody's mind is only thickening of the blood vessels in the atherosclerosis. We'll shortly have a journey to understand. Atherosclerosis is a specific type of hardening of the arteries, okay, where the plaques composed of fat, cholesterol, especially we mean LDL cholesterol, calcium, fibrin, some inflammatory cells and cellular debris, which builds up inside the arterial wall. The term comes from the Greek atheroma, that means a waxy thing, which deposits inside the arteries and causes sclerosis or hardening. Many biopsy reports we see sclerosis, that is hardening of the arterial walls. If you see the left side of the image, you can see a cut section of an artery where there are three types. If you can visualize my mouse point, external is tunica externa, the medium part of the vessel is tunica media, and the internal is a tunica intima. This we all know. Whenever this on the right side figure we see when the blood flows, it carries the cholesterols, and it basically all cholesterols, calciums, fibrins, they all start depositing as we age. And as we age, the deposits go on silently in our body. We are not aware. Specifically, they are observed in postmortem reports that the arch of aorta is the main culprit, where maximum fat this is deposited, hardening and cholesterol and atheroma is deposited. When this goes inside, we see that the blood vessel from inner side becomes narrow, and this yellow part is nothing but it is inner coating of the tunica intima, which basically narrows down the blood vessels. Then blood flowing through it can undergo clotting because the cells, they colloid on each other, specifically RBCs, WBCs. There can be a clot, sometimes it can rupture, and many things can happen. This happens in everybody's body when we are born, right from childhood days, starting till our end of life. Now, why is atherosclerosis important? This we should know. Atherosclerosis is the leading global cause of illness and death, underlying most heart attacks, coronary events, or coronary artery diseases leading to coronary vascular events basically occur because of this. Then peripheral arterial disease, we have seen gangrene cases in our practice. We have seen Raynaud's phenomena in our practice. They are all because of the deposits in our arteries, specifically the femoral, the popliteal, then the posterior popliteal, anterior hallucis, anatomically speaking. Annual deaths are 30 to 35% in India due to atherosclerosis. So almost we can say that 1/3 of the population, unfortunately, I will say, has to succumb life because of atherosclerosis, and which is progressing for years and years. It often begins in childhood, as you mentioned, and it progresses very slowly over decades. It doesn't progress in a night. Autopsy studies in some cases have seen that there are fatty streaks in children and young adults and advanced plaques in the people under 40 years also, especially they contribute to the risk factor. Okay. Now, let us understand the arterial wall and the lesions. Okay. The left side image will show you a cut section of an artery where I mentioned tunica externa, tunica media, and tunica interna. These blood vessels, they sound very big over here, but right from arch of aorta, 3 to 4 centimeters, to our minute capillaries, which are less than 1 millimeter, this arterial thickening goes on, narrowing in our body and to the organs. Slowly, what happens? This yellow part, that is the internal coating, goes on forming. If it forms in the big arteries, there is no immediate effect, but it forms in the small arteries. Sometimes the inner wall gets teared, and also sometimes because of the tear, the flowing blood may collide on each other, and we may get a clot. And because of the clot, we may get different things. Suppose it happens in the brain, we can get a stroke. That is, we can say because of the clots by the atheroma. One figure I will like to point out. Kindly look at the figure, which is specifically explained you. Just a minute. Yeah, I will request you to keep this figure basically in front of you so that you can visualize the things. Now, what are plaques? These are all deposits are called as plaques. I told you they are chronic inflammatory diseases which are characterized by arterial lesions. These are the plaques which we said. Okay. How do the plaques they develop? Now, this development of plaque is important. There occurs an endothelial injury. So you can see over here, my pointer is moving. This is the injury, endothelial injury. And why it is caused? Because the flowing blood may be high because of BP patients, because of smoking, high cholesterol in the blood of the patient, then diabetes, inflammatory diseases where we see autoimmune diseases. Some are genetically prone for vascular diseases or vasculitis. One of my good friends in Pune had sudden pain, I remember 2 months ago, and he had a sudden, because of the vasculitis, big clot in his femoral artery. And by God's sake, we are all thankful that his limb was saved because he rushed to the hospital in very less time. So these things can happen. Then LDL, what happens basically is there is at the LDL particles, they get deposited. When the flowing blood contains cholesterol, the LDL is the culprit which gets deposited. It gets trapped beneath the endothelium, which triggers inflammation. So while flowing blood, here LDL gets trapped and there occurs the inflammation as our body responds. Kindly understand this slide because it is going to be helpful for us in miasmatic determination. Then this triggers inflammation. Monocytes become as a foam cells. So here inside, when the plaque deposits, foam cells are formed and fatty streaks are formed inside the intima. This is the inner side, this is the outer side. So here you get a streaks over here of small muscles. They start developing below this atheroma. Then this develops a fibrous capsule, which develops over lipid the core. This is the yellow is the lipid core, and a fibrous capsule develops over here slowly through the ears of the smooth muscle cells, and they secrete collagen. After years, this plaque gradually increases in size, and arteries undergo compensatory remodeling. Some or the other day, because of the fragility of our blood vessels, because of our aging, this gets burst one day inside. Okay, the capsule ruptures. This is the capsule. This is a ruptured picture. It gets ruptured. Then the clots are formed and they are released inside the bloodstream, which either blocks somewhere as a clot or there is an active bleeding. So this should be kept in mind. Okay. So this is the phenomena. Friends, I'll request you to view this figure or this image. This is very helpful and it will be helpful in your practice also. You can have a photograph also to decide the miasmatic approach in further discussions, which we are going to have. Now, symptoms and the complications. Let's talk about this. Now, often patients are asymptomatic for decades. Many decades, in up to 30 years, 40 years, 50 years, 80 years, everybody is asymptomatic. There are no complaints at all in the arteries. Then even sometimes they get minor problems, they think this is due to age. Once the plaque ruptures, which we saw in the last figure, then there comes an emergency. It ruptures in somewhere in the brain, we call it cerebrovascular accident. Slowly we will be coming to it. In different areas, when this ruptures in the arteries, different things are diagnosed, and we see that the patients are getting treated in ICU. After coming home, as a second physician opinion, they come for our homeopathy. If coronary arteries are involved, there is a chest pain, shortness of breath, and chances of heart attacks. If the carotids are blocked, many times we see patients may get symptoms of dizziness, speech or vision problems. Risk of stroke is also there. If the peripheral arteries, like the leg or the arm, are there, while walking, they may get pain in the legs. And sometimes during the rest also, cold feeling or numb feeling also can be there. And if the plaque develops in the renal artery, then the kidney dysfunction occurs because of the less blood flow to the kidneys, which slowly damages the nephrons, and patient may progress to ESRD or the end stage renal disease or CKD, that is chronic kidney disease. Many times we also encounter that there is a hypertension to the kidney patients because of the deposits in the renal artery. This is nothing but the atheroma or the atherosclerosis. Now, what are the risk factors? See, all risk factors are known to us, but friends, some are modifiable and some are not modifiable. I'll just mention some few of them. Modifiable, I mean, they can be corrected and a normal lifestyle we can live. Suppose there is high LDL cholesterol and low HDL. HDL is a good cholesterol for the heart. LDL is a bad cholesterol for the heart. If it is there, with the help of our medications, diet, lifestyles, we can control them. Hypertension we can control as a risk factor of atherosclerosis by use of medications. Diabetes, insulin resistance, these also can be managed by us. Smoking or tobacco use can be restricted by counseling, by explaining the patient, showing them the images of the complications, and probably if they decide, patients, they may quit smoking or tobacco if they cooperate from their side. Sedentary lifestyle usually is not known to people because it causes many diseases, but if it is there, one should learn to socialize. Only counseling is not to help. Obesity is there. Nowadays, we see everybody is obese here in Maharashtra or in India. So we should strictly adhere to our height and weight chart and try to maintain that. Unhealthy diet, that means saturated or a trans fat or very high sugar diet. Many times, sugar itself is an addiction. After any good food, we have a habit of dessert. If we go in any party, we have soft drinks with the sugars, and we load our body every day with the sugar. If you are a diabetic, at least somebody is conscious. But if he is a non-diabetic, he is not conscious, and daily they load the body with sugars, but they also trigger the atherosclerosis. Inflammatory conditions like psoriasis, lupus erythematosus, then all the vascular diseases, they also contribute for the risk factors. But friends, with medications, auxiliary line of treatment, this is modifiable. What is non-modifiable? Aging. We cannot stop aging. Aging is not modifiable. So about the age of 65, we have to prepare our minds for these events and we try to prevent them. If there is a family history or a genetic predisposition, this also contributes a lot because many families have hypercholesterolemia. I have seen in patients, they take strict diet, they are on medications, on conventional or any other medications, yet their all cholesterols are high and they have low HDL, high VLDL, high triglycerides, and all, the what we can say, the cholesterols that are troublesome to the vessels are all rise because of the family history. In such cases, homeopathy can cater them good solution. Then also lipoprotein variants are there, lipoprotein A, and many variants are there. These are all lab diagnoses. Ethnicity is also there. In South Asia heritage, they have a high risk of atherosclerosis. The studies have shown this. Now, how to diagnose atherosclerosis? Because we can diagnose blood pressure by a machine, we can diagnose sugar by our glucometer, but there we should also diagnose atherosclerosis. This is very important. So how to diagnose it? There are certain blood tests which we can do and think for diagnosing this. Cholesterol levels, like I told you, everyone should go for cholesterols. One thing I would like to suggest, that previously it was done that fasting 14 hours cholesterol. Of course, it is good. But in my 33 years practice, I have seen fasting cholesterol samples, they all come normal. Only HDL is low, and we promote the patient to have omega-3 fatty acids. But if of the same patients, if you do postprandial or if you do random, we see that we are shocked because the triglycerides, the VLDL, low HDL, all figures are out of hand and their fastings are normal. So these figures are sometimes misguiding. If our patient is already prone for some type 2 diabetes, suppose we can say hypertension, any renal problem, then we should do both fasting 14 hours and postprandial cholesterols. So they are very helpful to us. Imaging is also done. For example, CT coronary calcium scan is there. Instead of angiography, this is not troublesome, and from that we can get an idea whether the blood vessels around the heart are getting blocked or no. Carotid ultrasound, we all are aware to know that from the carotid bulb, if the patient gets dizziness or any problem, we can diagnose the stenosis of both right as well as the left carotid artery. Doppler ultrasound is there. This is used for specifically renal arteries where there is a hypertension because of the renal artery stenosis. Then MRI, CT, angiogram, these are also very helpful tools to diagnose the ischemia or some, you can say, small infarcts in the brain because of the age. And these infarcts are wedge shaped seen in the scan, and they are due to atherosclerotic changes. Functional tests like stress test ECG can also be done, which will show us the myocardial viability as well as the ischemia. Physical examination, we can auscultate for bruit, abnormal bruits we can auscultate. We can also see for peripheral arterial disease without any blood test or imaging. We can do it with ankle branchial index, that is the ABI index. This is very good. We used to do during the internship time. Today it will be a homework for you to just search and conducting at least 5 of your patients who are more than 60. I am sure out of 5, 2 patients will be able to diagnose them as peripheral arterial disease without doing any expensive investigations. We should think for them. Now, treatment part. Treatment is usually, lifestyle and medical management. Only 2 options are available. Now, for the heart, if you think of a treatment, we should minimize the saturated and trans fats. Also, sodium should be restricted. We should increase eating fruits by peeling off the skin. Green leafy vegetables, but I'm not sure whether they are put in any color or they are adulterated. But organic green vegetables are welcome. Whole grains you can do. And nowadays, instead of exercising per day, now there is a new wave of weekly exercise. So you can do a weekly exercise plan. It does not mean that in a single day you should do a weekly. It should be a 150 minutes per week, a moderate activity. One of my patients did it in 3 days and he collapsed with dizziness. We should not do that. It should be steadily, and 150 should be divided by 7 or 8 days, and steadily we should do it. One should quit smoking, manage the weight, manage the blood pressure, the cholesterols and the sugar. But friends, even after managing blood pressure, cholesterols, cases of atherosclerosis are seen. Kindly keep in mind, because this is a natural process. We are aging, so this is observed. In conventional, you can say branch, medications are indicated. Now, what are they? Statins and lipid lowering agents. I will be not be talking about the conventional treatments. Being a homeopath, my role is with homeopathic medicines and a miasmatic approach. Antihypertensive, antiplatelet therapy, just to dissolve the clots or prevent the formation of clots. Then diabetes medications, wherever they're relevant. Every diabetic, it depends on the physician whether to give medications or to correct his only lifestyle. Now, suppose there is a severe block. We see, I told you an example of one of my good friends who was a homeopath. This photograph is not of him, it is a different photograph. Suppose this is the femoral artery. You go see the image. Many times the femoral artery gets atherosclerosed and it gets thrombosed, which has been seen on Doppler studies, where we get non-healing ulcers, then very weak posterior tibial pulsations, anterior tibial artery is also very poorly this thing, and there are chances of developing gangrene. In such cases, there can be taken a graft. This silvery color is a graft. This is a small one, but ironically graft surgically the surgeons take. They are called as vascular surgeons, and they save our limb. For carotids, if it is blocked more than say 50%, there are chances of developing sudden onset stroke or TIA, that is a transient ischemic attack, which we see in many people. For them, the treatment can be carotid and arterectomy if the vascular surgeon decides. Peripheral interventions, I just talked about the all ischemias and their stents, or you can say the grafts. Now, summary in general. For this summary, I'll take you to the previous figure. Just a minute. Kindly look at this figure. Now, plaque is slowly built up in our arterial walls, which I told you a few minutes ago. Then there occurs an endothelial injury. This is the endothelial injury because of oxidation of the LDL cholesterol. There is formation of foam cells which form a fibrous capsule inside the tunica intima, and one day it ruptures. And it ruptures because of high cholesterol, fragility of the arteries, then different arthritis or vascular diseases, and because of aging. And once it ruptures, the complications they begin. The symptoms may vary according to the organ affected. It can be angina, stroke, limb claudication, or kidney issues. Now, the risk factors are LDL cholesterol, smoking, diabetes, then obesity, then genetics and inflammation. Diagnosis, we talked about all diagnoses. Prevention should be to rule out the cause and treat it. Treatments, it all depends upon you. Like if treatment is necessary, homeopathic medicines can be given accordingly. Okay, yeah. So this is in summary. Now, conventional treatments. We should know this. Are there any limitations for conventional treatments? Yes, because conventional treatments, they manage symptoms, but they do not address the underlying cause of the disease. Now, why should we consider homeopathy? As we are homeopaths, it is because of that, or is there any specific advantage of homeopathy? Yes, as a homeopath, we have more grip in such cases. We can have more grip if we study the case and give. So we should consider homeopathy. It is a holistic vital force approach, and it all depends upon the individual care. Now, I'll be discussing a case so that you can get some idea about this atherosclerosis. A male aged 46 years, known case of hypertension from 5 years, he had come recently diagnosed with raised cholesterols, came to the clinic for the following complaints. Now, it happens many times. Patients have cholesterol, but they walk here and there. They have mild BP. They say, no, when I come to clinic, my BP rises. These are the common things which we encounter. But he came to the clinic with little bit some strange complaints. What were there? He was having a sprained feeling with chest comfort in the chest from 1 week. Sprained means sore bruise feeling is a different feeling. Sprained feeling is a different feeling. When you lift any heavy thing, you get a sprain. So he was having that kind of feeling in the chest, but it was from 1 week. Okay. And when was it? He said, sir, when I'm sitting, I am very comfortable. If I talk for 5 minutes, the sprains will be begin. At night, when I lie down, again I get sprain. I thought because maybe in Marathi it is called as Vata Prakruti, but from 1 week I am facing this. He was sitting quiet in my clinic during the case records. And then I was doing examination. I was looking at his reports. But whenever I asked him any question, he used to be very fast to answer. Maybe it was a part of his personality. Then He also, when on examination, had edematous mild swelling over the ankles, not so significant, but little pitting edema on the ankles and the knees. He said that he had a tendency for constipation. So, which he used to pass stools on alternate day. But some people have this constitutional defect. It is normal for them. Everyone, we should not think constipation, because we know normally daily we pass stools. Some people might have it, but he specifically complained about that there was a constipation and a hard stools for staining. I said that, what makes you relief when you talk and you get this strained feeling? He said, sir, I put on the fan and the AC, or sometimes I open the doors and windows, and I'm quite comfortable. But it is for some time. If I lie down at night, again the complaints will begin. He was having like just strained feeling and nothing else. So on these complaints, should we reporterize these complaints and give him remedies? I request everyone to type in the chat also. I will enjoy that, because these queries we all encounter in our practice. Surely, but clinical diagnosis is also very important, because the patient was 46 years old. He was not 25 or he was not 18 years old. So what was the clinical diagnosis which came to your mind? You just keep it in your mind and we will proceed again. The diagnosis was angina. Yeah. This is an angina where you get sprain. Feelings are expressed in different ways. Sprained feeling, pull-like feeling. Then that copper wire of feeling is very rare with of cactus, which I have witnessed in angina. But these are the common words or terminologies used by the patients. That's about it. Yeah. So the patient was clinically having angina. This we know. Just see his lipids before. If you see, the triglyceride levels were 659. For the safety purpose and legal purpose, we have hidden the name and the lab things. If you see, the LDL cholesterol was 85. We saw that it was optimum should be below 100. So it was not alarming, because that is the root cause for increasing the fibrous capsule growth and formation of foam cells, which we saw now. But the levels were very high of triglycerides. He was having a family history of hyperlipidemia, I'll tell you, when taken in detail. Then, after treatment, for some time, we repeated his test. They show a significant improvement in the triglycerides. They came to be 387. They are high, I know, but at least the figures have turned towards settling down. If you see the LDL levels, they were 74. That is there. So at least they have a little bit come down. So hypercholesterolemia and these complaints, we clinically diagnose him as angina. On reporterizing this, because I was said that there is no any emergency, I reporterized the case. We, in generalities, we took these rubrics: pain, sprained acid, circulation, complaints of blood, lying down aggravation, is specifically mentioned. Then only if you take broadly lying down aggravation in generalities, you will get around 40 remedies, and they are misleading sometimes. So we should go to specific. Circulation, complaints of blood, where talking aggravates. In general, talking aggravates, and circulation talking aggravates minimizes our quite work and reduces to good less number of remedies. While talking, while during the discomfort feeling, he used to just close his eyes and sit in open air, which ameliorated him. So we took this rubric. He had also joint pains little bit, but not significant. But ankle swelling was there, so we took ankles, extremity swelling, ankle edematous. Whenever answered, he used to answer very hastily. It was a part of his personality. So like we took that rubric also. He was sitting very quiet during case taking. So like this disposition is there. Open air, or like you can, so doors and windows open, and he used to always go there. So this rubric was taken, that magnetized amyloids. This is my rubric, we can say. And constipation. The remedy selected was lycopodium. I'll tell you. The 3-4 remedies had basically been over here. But looking at all his complaints, then the symptoms covered, we should never rush to give first or second remedy on reporterization table, because sometimes we give near similimum, not the proper similimum. Even lycopodium is, you can say, near similimum. I will say it is not this. Now, after giving lycopodium, this was the ECG which I saw this thing. If you can like verify, or we can witness, see the V2 and V3 waves. These are going down. I'll show you with my arrow. This is the ischemia. V1, V2, V3 are the chest leads, where over the chest they are put on. So this patient was having some anterior wall ischemia. This I'll tell you. So these were down while examination the ECG. After treatment, I was very surprised that If you see this V1 and V2, see this ST segment almost in V1 has come to normal, and this V2 segment is also normal. So even I could not believe that homeopathy works here and lycopodium has helped him. So really the even cardiologist asked him, are you taking anything else with our statins or with our medications? So he admitted he's taking homeopathy for it. So friends, such things also can happen in our practice. Many cases I have got with of ECG which have reverted the ischemia, and really it is good to document such cases. That is correct. Now remedy selection, why it was done, I'll tell you in short. Edematous swelling on the joints, I told you, because the lycopodium was selected for that. Because the blood vessels, like pains and blood vessel complaints, which are more on talking and lying down, because that causes spasms. So this was considered a hard stool, sprained easily. This we have taken, and answering excellent quite in nature. Because of the classification of miasms, we can see this goes. I know everyone is having knowledge of miasms, psychotic miasm. So this they basically lycopodium is a triasthmatic drug, but psychosis dominated in this case. So we selected this medicine. So the based on the psychotic miasm, the edema, and other all above complaints, we gave him lycopodium 200 for 4 days, and after that we had given SOS whenever he feels any sprain feeling. In 5 to 6 days, his pains were 80% better, which were never better with any medications. He was very happy. And we had to repeat the doses occasionally in 3 months. His lipids already settled to half, and ECG showed a correction in the chest. So that was really a rewarding thing, and we were happy about that. Only 2 cases I am taking. I will be going for the second case now. Now, a female is having diabetes hypertension since 8 to 10 years, came to the clinic, complaint of sudden onset chest pain and discomfort. She had a spasmodic cough, which was a dry in nature. She was having BP sugar. This is very common in our practice. But sweating episode was there, profuse, which made her feel weak. And she was looking anxious. And the complaint had developed suddenly, which she said. On examination, the pulse was a little less. It was 56 per minute. BP was also low. That is 96/64. She was on hypertensive drugs. Temperature was little bit because of sweating. There was a hypothermia. BSL was 320. So definitely it was raised. What to do? In such patients, should we go for repetization? Should we give for her medicines immediately? Should we go on taking detailed case taking if she's anxious? Everyone encounters such cases in our practice, but we should individualize them properly. You can think in your mind, only in 10 seconds, we will see what to do. See, in our mind, many things come. What approach should be taken, what not. But looking at the scenario, which we did was this. Admit the patient with primary medications. Sweating, low BP, sugars high, feeling dizzy, we should not take risk. But on the present state, I had given her carbohydrate 30, few doses till she reached the hospitals, looking at her collapse conditions and the sinking vital force. Now, what was she diagnosed? I could not diagnose this, but the vitals were wrong, so it was alarming for this thing. In hospitalization procedure, these ECGs and angiograms were taken in the hospital. They are not of mine, but after coming back also and after visiting there, this was seen. If you see lead 1, lead 2, and lead 3, then in lead 1, the ST segment was depressed. Lead 2, lead 3, ST elevation was there. So she was diagnosed to have inferior wall infarct. If you see right side the coronary angiogram, you can see that the left coronary artery, which is the descending artery, the arrows will show you narrowing because of atherosclerosis, which we are studying today. If you go down, this is the lower side of the heart, and circumflex arteries are there, and like she was managed over there with this. So this was a diagnosis. But on the second day, her pains were there, but cough was there. So they gave me a call that along with conventional treatments, they wanted homeopathy. So I visited her. There we took these rubrics: circulatory system, heart pain, neuralgic, that means angina. This rubric we had taken. Anxiety from pains, which were from the chest. So we took one rubric. Then sweat was a concomitant. So like sweat we took, but it was a concomitant. It is very important. But I thought it would be a general symptom in heart complaints. So not a specific, because then they lead to all arsenic and carbohydrate and veratrum, and we get messed up in that. So I did not give you any value on repatriation. Respiratory system, sudden onset cough was there, which was a dry hacking because of the angina. She had angina. Retrosternal spasms were there, so she developed cough. Or repatriation, arsenic was there, aconite was there, kalika was there. These are the all leading remedies. If we enter the symptoms, they come. But we gave her spongia. Spongia has got a specific affinity for the heart, and it helps for the blood vessels also. Provings have also proved it, and studies have also proved it. So we gave her angina looking at the complex, like this drug. And she relieved a lot with the cough and the discomfort. Now, many times the junior doctors, they ask us, sir, except boric, we cannot get atherosclerosis rubric anywhere. So what to do? Those who have got software, it is okay. But few rubrics I'll tell you. There is a repertory called as hypertension repertory. I don't know if you have it. It is available in some softwares. I have all the softwares license copies which are available over here in India. I use also one of them is having a hypertension repertory. In that, you get a rubric called as straight atherosclerosis with, and this right side like aurum, dysphoria, or our fair drugs are given. Synthesis repertorium also gives you a rubric. We are under the chest, you have atherosclerosis of coronaries. Generalities also you can get atherosclerosis, ossification, and degeneration. In Robin Murphy's repertory, you get a rubric as arteriosclerosis. Many times we search atherosclerosis in Murphy and we never get it. That happens. So we should find out for arteriosclerosis. Then the medicines mentioned are on the right side. Atheroma is also there, which I told you. It develops in the arch of the aorta at the posterior side at the age of 25, 30 years, and it progresses as we advance. So for them also, we are very lucky to have remedies for that, which are mentioned in Robin Murphy's repertory. Pathak's repertory is a small repertory based on generalities more. It gives you only single remedy listed under that is the sumbul, atheroma of the arteries. It only mentions as a sumbul. Boric is a clinical repertory we saw. We get atheroma of the arteries where aurum, phosphorus, plumum, these medicines are there. Kent's repertory, we can get, many people think that Kent is only for mentals, but we can get a rubric in Kent as arteriosclerosis with a medicine like adrenaline, ursiode, cuprum, clonine, they are mentioned. So these are some rubrics which we can get in our repertories and help us while solving the case. Now is the main part. I'll go through it. Miasmatic approach. Friends, this is your bread and butter. This is your area. This is my area and a homeopath's area. Now we should understand this properly to get good results and to complement the conventional treatment and to complement the health issues of our patient. So quick overview I will take. When a homeopath takes a miasmatic approach, atherosclerosis, they are interpreting the underlying chronic dispositions, the patient's tertiation. Okay, that means using Hahnemann's classical triad of persistent miasms. Atherosclerosis and related dyslipidemias and hypertensions are commonly mapped to combination of psoriasis, syphilis, and psychosis. Now, friends, miasmatic things of atherosclerosis and dyslipidemia. We have dyslipidemia many cases. Now, if a dyslipidemia case comes to us and we have a psychotic presentation, what can we think? These are the things. There is lipid deposition, which we saw in that slide, the deposition of the yellow lipids, and calcification. So if the patient gets on angiogram, these two things, the patient is having psychotic miasm. If there is LDL excess, then the smooth muscle proliferation is there. Then there is formation of foam cells. I told you, formation of a thin fibrous capsules, and there is thickening of the arteries. So this happens in psychotic patients. Associated with varicose veins, overgrowth, ossifications, there are pseudosoric tendencies are there, which further lead to psychosis. These all things like, deposition and all the things we get in Doppler studies or sometimes with the angiogram report when the patient comes to us. So along with our case taking, we should think what is going on and the miasm psychosis can be decided on that. Okay, now we talk about the syphilitic miasm. Suppose a plaque gets bricked, there is loss of vascular elasticity and sudden emergencies there, which leads to structural deterioration, arterial stiffening, fibroid necrosis, and reduced elasticity of the heart. They go into syphilitic miasm. Post-infarct cases are syphilitic miasm, or during active infarct also. Commonly, we can see that common in phase of hypertension complications like malignant hypertensions, which we get in renal artery problems or the renal cases. LVH or any retinopathies which we see, then in such cases there are syphilitic cases. We see many times there is bleeding on the retina. Then there is sudden vision loss of the patient because of the arteries issue. So we can think of this miasm. Case study on hypertension side that syphilitic incidences, they lead to widespread destructive changes in the body and fibrinoid necrosis of the vascular wall. Left ventricular hypertrophy is very common. We see LVH, dyspnea, low ejection fraction. Usually it is a syphilitic tract. We should keep in mind. Medicine selected on this will give you miraculous results and in your practice on the miasm. SORA. Now, are all atherosclerotic SORA? It is a constitutional disposition. Often it is a superficial miasm where there is a superficial functional manifestations like headaches, anxiety, obesity. Then they proceed with some structural changes in long term. But SORA is like foundation for all the chronic miasms. We should keep in mind 70% patients are SORA. Dr. Heinemann has mentioned it, and they are the part of integral to the case totality. So psoriatic patients are there. Now applying miasmatic insights into the practice. What should we do? We should begin with repolarization, all these cases. That is very important. Arteriosclerosis of the arteries and atherosclerosis. Now, key remedies which are found, each patient is different, but key remedies are there which help a lot. So these key remedies are arsenic iode, which we have seen in maximum cases they are helpful, aurum, met, cactus, Baratakar of calcarea fluor, cuprum, strontium carb, etc. But see, basically calcarea fluorum and aurum metallicum are basically antipsychotic and antisyphilitic. But antisyphilitic dominate more for these remedy actions. So we should keep these remedies in mind for miasm point of view. Miasmatic insight, we continue it. Identify the dominant miasm through symptoms. What symptoms are expressed by the patient and what is dominating, that we should think. So what are psychotic signals we can see in atherosclerosis? There is a family history of obesity, family history of warts or constipation. Even the past history of the patients may show this. Vessels, they may show poor inflammation clearance, pitting edemas and thickened vessels. Mental and emotionally, people are jealous, guarded, and they're suspicious. These are psychotic tendencies. These are seen in many patients that they are suspicious. These are the psychotic signals from which we can diagnose the case of leading miasm in a case of atherosclerosis. What is the syphilitic signals? Early onset arterial calcification. Like suppose at the age of 40, somebody undergoes angioplasty. That is early calcification. So this is a syphilitic signal. Jerky rheumatic pains. People show us that sudden spasm of their fingers occurs. So they have jerky movements also. There is a dramatic weight loss, family history of diabetes, or early cataracts. I have seen a baby of 5 years old having cataracts, and he was operated. I was surprised to see this case. Then recurring ulcers on the mouth, tongue, gangrene, and past history of any suppressions. Then this miasm usually shows syphilitic signals. We should keep in mind. Now, the approach for such cases should be layered approach. We cannot say that we match the symptoms and give the medicines. What is your first prescription? It should be like where there is no complications, nothing is there, all reports are only able to do it. Usually, I'm not saying all, because physical journals may vary out to patients. Constitutional remedy is based on present totality. Take note of which miasm it appears or which signals it is given. So that should be your first prescription. Or you can minus the word as a constitutional remedy. You should give on the dominating symptoms, and then you can think of the miasm which it is covering. There should be a follow-up after 6 to 8 weeks. You cannot come to one constitutional remedy and give it for 2 years to the patients. You should have a follow-up of this patient. Observe the Herring's direction of cure. Recheck cholesterol after 3 months. This is very important. If our medicines are acting on low, the lab values will also show us. BP should come down. Examine the miasmatic shifting. Example, reduced growth, structural degeneration. We cannot do angiography repeatedly to see the reduced growth of the atheromas. But I told you the ankle brachial reflex can show you in peripheral artery disease. We should think for that. And what should be your second prescription? That is very important. Anti-miasmatic remedy, if there is a shift from psychotic to syphilitic pattern which has emerged. Suppose a silent psychotic patient is having treatment with you and he presents with a heart attack or he presents with a bleed somewhere, your prescription is supposed to change. So it depends on that. So there should be a layered prescription for such patients. Now, cautions and consideration. See, homeopathic miasms are theoretical. They are not substitute for a standard cardiovascular evaluation. Keep this in mind. Never accept challenging cases with homeopathy because we are not trained in ICU to give only homeopathy and watch the cases how they recover. So they can complement with these treatments, but the miasmatic study is not a substitute, that we should keep in mind. Repolarizing is a must and it should be individualized all the time. Do not label a patient syphilitic simply because he has atherosclerosis. People make mistakes that all are syphilitic. No, do not make these mistakes. Monitor conventional labs, that is LDL, carotid test, carotid Dopplers, pulse waves velocity, and and also see the improvements. If optimizing for mother tinctures in emergencies, many doctors, they are tempted to give mother tinctures, but like Oromet 3X or Cactus 30C, they are given, but use them sparingly to avoid the confusion in case progression, because mother tinctures are given for a long time and the case progresses in a different way. All the important characteristics get masked. Patient gets some relief but never cured. And we also get confused, like what are the symptoms, and we keep on probing. How is your thirst? How is your bowels? And we land up into mistakes. So we like limited use should be there. Now, takeaway key points. We are coming to it now. Now, what are the takeaway key points now? See, atherosclerosis is a slow and silent process, which we saw, that gradually stiffens and narrows the arteries, limiting the blood flow. Over time, this can lead to serious cardiovascular events, but early detection and intervention, especially the lifestyle changes and the medical treatment, can dramatically slow down and prevent its progression, allowing the people to live long and active life. Leading a disabled life in old age has no meaning. So till the end of our breath, we should be active. And if we diagnose it properly and we take due care, we can lead a normal life till the end of the cycle of human life. Ethical and practical notes. This plan is meant to complement, not to replace the medical treatment. Everyone should keep in mind after this lecture. Then coordinate with the patient's cardiologist and the endocrinologist. Many times there is a mistake made that, sir, can I stop all the cardiac drugs and only start with homeopathy? No, don't take a risk. They will drag you to the court. That is very important. So always talk to the cardiologist, endocrinologist in diabetic hypertension patient, explain them that we have good medications, we have anti-miasmatic remedies, and which are not in other pathies, and we can complement your treatment and then be with the follow-up. Avoid overuse of mother tinctures. I have seen all patients with cardiac any event taking Crataegus. I don't know why, because it is in boric. Everyone is on Crataegus. Everyone in some patent preparation. Avoid using this because they will mask the symptoms. They will give temporary relief, but they will never cure the patient. When you want to give a long-term treatment, friends, think for LM potencies, where the patient is very sensitive and there is, apprehension of drug aggravation or any deep acting states if the medicines are selected, especially the mineral kingdom remedies. For that, you can opt for LM potencies. They are safe. Then, miasmatic hierarchy is a clinical lens. Observe the totality and the unique keynotes. Do not observe the pathology. Sometimes what happens, people come with post-infarct, then heart infraction, heart blood vessels, and blood coagulated, and all they mislead you, all these general symptoms. So do not just depend on the pathology. Miasmatic hierarchy, where I told you, psychotic signals are there, syphilitic signals are there, sometimes storic functional signals are there. Think them, write them at the side of your case paper, and along with your totality, consider them in your prescription, which will give you miraculous results, I'm very sure. So in summary, atherosclerosis is primarily a psychotic, that means a lipid overgrowth calcification, with syphilitic aspects, with degeneration and collapse of arterial integrity that occurs. SORA is rarely visible in atherosclerosis, but in atheroma, but it fuels the susceptibility and cynical reactivation. It adds a fuel to the fire, SORA. By tracking the dominant layer of the miasm expression, you can tailor the remedy strategies in fusion with repertory, clinical totality, and Herring's law to support a holistic recovery. We want a holistic recovery of the case. So friends, I'm very much thankful. This is my communication address. For anything, you can just communicate with me for any queries of this lecture. One small homework I'll give to you all. There are some arteries in our body, in our whole lifetime, very minimal or no atherosclerosis they undergo. This is the homework for all. If you can find out these blood vessels, you can kindly send me on this my personal number or our IFPH. This is a small homework for you, just to know that which arteries do not undergo atherosclerosis. This is very important. So thanks for IFPH team and all the attendees. If there are any questions, I'll be very happy to answer them. Thank you, sir. May I hand over to Dr. Binduraj, sir? Yeah.
Thank you, doctor. And it's a time to interact with the speaker.
Yeah.
You can raise your hand or use the chat box.
Yes, thank you, Dr. Bindraj. Dr. Indraneel Bawadekar, definitely you have got the potential and have the always keeping the your individuality present in the all presentations. And this is a major section or portion often going unattended in homeopathy. Everybody is with some sort of prejudice. If you have got some cardiological conditions, then you must take allopathy medicine. You must consult the cardiologist. So,
Very true.
but definitely, like all other conditions, this is also we must approach unprejudicedly. At the
Very true.
same time, the legal aspect, as you rightly mentioned, that should be taken into consideration. Otherwise, we have to go to the court, especially the period of consumerism. So what is needed? I think a protocol is needed. What should be done at this juncture? What are the flow chart is an essential, and somebody should specialize on these subjects.
Yeah.
Definitely, also we should have some courses, at least some diploma courses.
Short courses.
Yes, in cardiology. So a lot of homeopathic medicines are there. A lot of talented persons are there. But what is needed is a legitimate course so that they
That should
can
be there.
specialize themselves.
Very
Okay,
true, sir.
thank you.
Very true, sir. Your point is very valid. Yeah, because you are never trained to manage emergencies and when to refer. Many homeopaths are confused when to refer.
Yeah.
In COVID, I was in the patients were managed at by homeopaths, which were ICU cases, and they landed up into trouble. This should not happen. Correct. You have raised a very nice point. Yes.
Thank you.
Thank you, doctor. And so, observing the totality and unique keynotes, not just pathology, is the key thing I think you coined, and pointing the right miasmatic approach also for selecting the medicine is also very important, isn't it?
Excuse me, Dr. Bindra, there is a question in chat box.
Yeah.
How can tackle all infarct? Any precautions in such cases we can take?
Yeah. All infants are usually, these cases come to us. This is a nice question. I welcome this question. See, these cases are in our house also. Our parents also must have sometimes badly suffered from infarct. What to do? For every time for a chest pain, you cannot go to the ICU and get admitted. All infarct should be diagnosed by the cardiologist. We should see the angiogram reports. If the angiogram reports show us that there is a massive atherosclerosis of the vessels, for example, the left anterior descending or the right coronary artery, the remaining culprit arteries, we should start treating with homeopathy, symptomatology, and the miasmatic approach. These things can be definitely achieved. I have seen people having improvement in the ejection fraction after introducing our medicines along with the conventional treatments. So you should continue them, and we can have as a complement with our miasmatic approach. We should do that. And precautions to be taken, that means control the underlying cause. If somebody is smoker, we should quit it. If somebody is diabetic hypertensive, that has to be controlled. If somebody is having autoimmune disease, it has to be controlled and kept in mind. Repeatedly, the C-reactive protein should be done to know the inflammatory markers so that we can know where the case is progressing and is it having inflammations in the arteries. We should keep in mind.
So exciting cause, maintaining cause, and fundamental cause.
Very true, sir. Very true. Both should be considered. Both should be considered. So, like in such cases, we can take good care of the patients. Yeah.
Excellent. Dr. Rampravesha. Just a minute.
Thank you, Dr. Bindu Raj sir, and Namaskar, Dr. Manoj Jia sir. Congratulations, Dr. Indraneel Bawadekar sir. Excellent session. Very nice management of atherosclerosis disease, arterial disease, and cardiovascular disease. जो है deals the miasmatic cause, sora, psychotic and syphilitic, and miasmatic remedy is a very important in disease and management. Lifestyle is the very important management. Lifestyle, diet, very important. Due to hypertension and background of highly fear disease, due to
Yeah.
fear.
Very true, sir. It causes coronary spasms. It causes coronary artery spasms. I fear.
fear.
Very true. Very. You have touched a good point. Good point. Yeah.
So
yeah.
very, very thanks.
Thank you, sir. Thank you.
Dr. Dhanesh.
Yes. Yes. Thank you, Dr. Bindaraj and Dr. Indrani about this. It's really a very good session. Usually people from our side used to have a little bit of hesitation in treating cardiac diseases, cardiac problems also. But homeopathy has the right remedy for each, right solution for each and every case. The problem is that we may not be able to diagnose the case, in the very beginning, but usually patients come to us after consulting a lot of cardiologists or physicians, and in those conditions we can go ahead with our treatment. But what people may have a fright that, oh, whether I should stop all the medicine all of a sudden or not.
Yeah,
That is the biggest challenge in front of the patient as well as in front of us. But the solution is we can have the solution for that. We can just ask the patient to continue the medication along with the most relevant medicine or most important medicine for the patient, and then we can add some of our medicine, and gradually we can reduce the medicines they use. And once a patient get the confidence, then patient can he himself it may be ready to withdraw all the medicines. And then,
Very true. Very true, sir.
that's what we can save the patient with homeopathy also.
Yeah. Correct. Very nice, sir. Yeah.
Okay, thank you very much for such a beautiful presentation in this evening, particularly on cardiology.
Thank you, sir. Thank you. Yes.
We can have some more presentation in the future also.
Sure. I'm happy to have you all together to be hearing to me for last 1 hour. I'm very thankful to all of you once again. Thank you, sir. Yeah.
Thank you, Doctor. On behalf of IFPH, I thank you for this wonderful session, and I thank you all for presenting presenting the session. And it's time to start the Malayalam. Over to Dr. Manoj for the Malayalam session.